Hi everybody, and welcome to another episode with the Anxious Resistance. Today I'm going to be talking about a medication called Brexanolone. Now this medication is for postpartum depression. I know a lot of you are men, a lot of my audience is men, but trust me, this is still going to be relevant to you because if this medication works for postpartum depression, there may be some potential use for other forms of depression or even other mental health conditions. Okay, so to start off, let's talk a little bit about postpartum depression. It's a serious and common mental health condition that affects many women after giving birth. PPD, postpartum depression, can cause persistent and severe symptoms of sadness, anxiety, guilt, and loss of interest in daily activities, as well as impair the mother's ability to bond with and care for her baby. Postpartum depression can also increase the risk of suicide and other complications for the mother and the child. Postpartum depression affects about 1 in 8 women in the United States, but many of them do not receive adequate treatment due to stigma, lack of awareness, or limited access to care. Now let me just throw in a personal note here. I actually see a lot of postpartum depression in a clinical setting. Oftentimes, mothers who have just given birth are transferred from the mother-baby unit to the inpatient psychiatry unit because they're having a lot of difficulties. They're very dysphoric. They're very depressed and sometimes even psychotic, which is a little bit different. Some postpartum psychosis is a little different than postpartum depression. I would say if you get really bad PPD, you might end up with some psychotic symptoms as well. So they're a little bit tied, and it's all due to, the drastic hormone changes that occur during and after birth. Okay, so Brexanolone is a new and innovative medication that was approved by the FDA in 2019. So very new by medical standards for the treatment of postpartum depression in adults. Brexanolone is the first drug specifically designed to treat postpartum depression, and it has shown promising results in clinical trials. In this video, we will explore what Brexanolone is, how it works, what evidence supports its use, how it is administered, what side effects and risks it may have, and what are its overall pros and cons. So to start off, what exactly is Brexanolone and what makes it unique? Brexanolone is a synthetic form of a naturally occurring hormone called allopregnanolone. Allopregnanolone is derived from progesterone, a female sex hormone that plays a key role in pregnancy and childbirth. Allopregnanolone acts on certain receptors in the brain called GABA-A receptors, which are involved in regulating mood, stress, sleep, and cognition. Allopregnanolone levels normally rise during pregnancy and drop sharply after delivery. This sudden drop may contribute to the development of postpartum depression in some women. Brexanolone mimics the effects of allopregnanolone by binding to the same GABA-A receptors and enhancing their activity. By doing so, Brexanolone may help restore the balance of brain chemicals and reduce symptoms of postpartum depression. Brexanolone is marketed under the brand name Zulresso. So let's talk a little bit about the history of Brexanolone. Brexanolone was developed by Sage Therapeutics, a biopharmaceutical company that focuses on developing novel therapies for brain disorders. Brexanolone was originally discovered by Dr. Stephen Paul, a former executive vice president of Eli Lilly and Company. He joined Sage Therapeutics as its president and CEO in 2013. Dr. Paul had previously worked on developing drugs for Alzheimer's disease, schizophrenia, and depression at Lilly. Brexanolone was based on the research of Dr. C. Neil Epperson, a professor of psychiatry and obstetrics and gynecology at the University of Pennsylvania School of Medicine. Dr. Epperson had been studying the role of allopregnanolone in mood disorders for over 2 decades. She had found that allopregnanolone levels fluctuate across the menstrual cycle and during pregnancy and postpartum periods, and that these fluctuations may affect women's mood and cognition. She had also shown that administering allopregnanolone to women with postpartum depression could improve their symptoms. Sage Therapeutics licensed the rights to Brexanolone from the University of Pennsylvania in 2010. The company then conducted several clinical trials to test the safety and efficacy of Brexanolone for postpartum depression. The results were positive and showed that Brexanolone could rapidly and significantly reduce depressive symptoms in women with moderate to severe postpartum depression compared to placebo. Based on this data, Sage Therapeutics submitted a new drug application to the FDA in 2018. The FDA granted Brexanolone a breakthrough therapy designation, a priority review designation, and a fast track designation, which are intended to expedite the developmental and approval of drugs that treat serious or life-threatening conditions with unmet medical needs. The FDA did approve Brexanolone for postpartum depression in March 2019. Okay, so how does Brexanolone work? It is a positive allosteric modulator of GABA A receptors. This means that Brexanolone binds to a specific site on the GABA A receptor that is different from where the natural ligand GABA binds. By binding to this site, Brexanolone enhances the effect of GABA on the receptor, making it more responsive to GABA stimulation. The results in increased opening of chloride channels on the cell membrane, we're talking about neurons here, which leads to hyperpolarization, a decrease in electrical potential of the cell. Hyperpolarization reduces the excitability of the cell and inhibits the transmission of nerve impulses. This can have various effects on brain function, such as reducing anxiety, inducing sedation, and modulating mood. Brexanolone is thought to act on both synaptic and extrasynaptic GABA A receptors. Synaptic GABA A receptors are located at the junctions between neurons, also known as the synapse, where they mediate fast and transient inhibitory signals. Extrasynaptic GABA A receptors are located outside the synapses, where they mediate slow and tonic inhibitory signals. Brexanolone may have different effects on these two types of receptors depending on their subunit composition and distribution in the brain. Brexanolone may preferentially target GABA A receptors that contain alpha-4 and delta subunits, which are expressed in brain regions involved in mood regulation, such as the prefrontal cortex, hippocampus, and amygdala. A lot of big words there. I know that was a pretty detailed explanation of how this works, and part of the reason for that is just because this is totally new. I mean, this is different than what we've been using for depression treatment for the last 30, 40 years. It's not an SSRI. It's not an SNRI. In fact, it targets GABA, which anxiety medications do, but not depression medications. Brexanolone may also affect other neurotransmitter systems such as serotonin, dopamine, and glutamate, which are also involved in mood regulation. Brexanolone may modulate the release and reuptake of these neurotransmitters by affecting the activity of their transporters and receptors. Brexanolone may also influence the expression of neurotrophic factors, such as brain-derived neurotrophic factor, which is very important in mental health. In fact, I do a video on BDNF itself and its significance. So again, BDNF is important for neuronal survival, growth, and plasticity. Plasticity meaning the ability to adapt and change. So what is the evidence for use for Brexanolone? The efficacy of Brexanolone for postpartum depression was demonstrated in 2 pivotal phase 3 randomized, double-blind, placebo-controlled trials, Study 202B and Study 202C. These trials enrolled a total of 247 women aged 18 to 45 who had a diagnosis of moderate to severe PPD, defined as a score of 26 or higher on the Hamilton Rating Scale for Depression, also known as the HAM-D. The women were randomly assigned to receive either Brexanolone or placebo as a continuous intravenous infusion over 60 hours. The primary outcome measure was the change from baseline to 60 hours in that HAM-D total score. The secondary outcome measures included the change from baseline to 30 days in the HAM-D total score. The proportion of women who achieved remission, this is defined as a HAM-D score of 7 or lower, or response, which is defined as a 50% or greater reduction in HAM-D score at 60 hours and 30 days. So there are 2 time frames here. 60 hours after delivery of the baby and 30 days after the delivery of the baby. The results of both trials showed that Brexanolone was superior to placebo in improving depressive symptoms at 60 hours. In Study 202B, Brexanolone reduced the HAM-D score by 19.5 points on average, compared to 14 points for placebo. The effect size of Brexanolone was large and clinically meaningful. Brexanolone also improved other secondary outcomes such as remission rate, response rate, anxiety level, functional level, and quality of life at both time points. So both time points being the 60 hours and 30 days. The safety of Brexanolone for postpartum depression was evaluated in 4 clinical trials and involved a total of 289 women who received Brexanolone and 102 women who received placebo. The most common adverse reactions reported by women who received Brexanolone were sleepiness, dry mouth, loss of consciousness or syncope, and flushing/hot flashes. Most of these reactions were mild to moderate in severity and resolved without intervention. However, some serious adverse reactions occurred in women who received Brexanolone, such as excessive sedation that required intervention, syncope that resulted in falls or injuries, and suicidal ideation or behavior. These reactions led to the discontinuation of Brexanolone infusion in some cases. Now, I just want to note here at this point that many antidepressants have these severe adverse effects in a small amount of those who take them. So don't let that discourage you from finding the potential solution. All of these issues, at least, in this case, what I'm seeing can be prevented or even harm reduction after the event. Suicidal behavior, you discontinue the infusion, you get severe syncope, you discontinue the infusion and let the drug run out of your system, and then you're okay. But that shouldn't dissuade those who receive such a positive benefit from this. Okay, so how exactly do they dose Brexanolone? It's administered as a single continuous intravenous infusion over a period of 60 hours, which is 2.5 days. The infusion rate is titrated according to the patient's weight and response. The initial infusion rate is 30 micrograms per kilogram per hour. And then this is adjusted over time. I'm not going to bore you with all the different stuff, but if you want all the details on how it's dosed, check out the link in our article in the description, and it'll have all the details in there for you. So Brexanolone is only available through a restricted program called the Zulresso REMS program. This program requires that Brexanolone is only administered by certified healthcare providers in certified healthcare facilities that have the ability to monitor and manage the patient's vital signs, oxygen saturation, and level of consciousness. The patient must be accompanied by a caregiver during the entire infusion period and must not drive, operate machinery, or care for children for at least 7 days after the infusion. Okay, so this is a little bit similar to when we use ketamine infusions in inpatient psychiatry. You have to monitor this patient for an amount of time afterward to make sure that they're not going to have these adverse effects. Now, it's not several days to a week like Brexanolone seems to be. Ketamine, generally, you know how it affects you within the day, so you know whether you're going to be okay to drive or something like that. So what are some side effects and adverse reactions that can occur with Brexanolone? This can include excessive sedation, loss of consciousness, which I talked about before, that syncope, suicidal thoughts or actions, and other common side effects include dry mouth, flushing, headache, nausea, vomiting, constipation, diarrhea, dizziness, fatigue, fever, chills, cough, sore throat, muscle pain, joint pain, back pain, breast pain, abdominal pain, urinary tract infection, and rash. I know I sound like those commercials that just list off all the side effects. These side effects are usually mild to moderate and generally go away on their own. However, if they persist or become worse, the patient should inform their healthcare provider. Again, you're in a monitored situation here when this is being administered. You can bring it up to your physician, your nurse, who's there attending to you anyway. So Brexanolone is also contraindicated in patients who are allergic to any of the ingredients in Brexanolone. I know they always say that, but sometimes there's filler substances or things in these infusions or injections that people are allergic to, so you need to be careful and make sure that you're not allergic to any of the things inside of it. Brexanolone should also be used with caution in patients who have a history of seizures, liver problems, heart problems, or bleeding problems. Brexanolone may interact with other medications that affect the GABA-A receptors, such as benzodiazepines, barbiturates, opioids, antidepressants, anticonvulsants, and antihistamines. Now, not all of these will act on the GABA A receptor, and your provider or your pharmacist should know which ones of these may interact with the GABA A, but I know particularly those benzodiazepines, the barbiturates, they'll hit on that. Alcohol hits on GABA. You don't want to drink alcohol while you're having this infusion. Again, you're going to be in a hospital scenario, so I don't think they're going to be letting you take your tequila shots while you're in there. So the patient should inform their healthcare provider about any and all medications and supplements they're taking before receiving Brexanolone. Okay, so what are some positives of Brexanolone? It has several advantages over other treatments for postpartum depression. The first being specificity. Brexanolone is the first and only drug that targets the underlying hormonal imbalance that may contribute to postpartum depression. Brexanolone directly mimics the effects of allopregnanolone. The next being its efficacy or effectiveness. Brexanolone has shown to be effective in reducing depressive symptoms in women with moderate to severe postpartum depression in clinical trials. Brexanolone has demonstrated a large and clinically meaningful effect size compared to placebo. Brexanolone has also shown to improve other aspects of mental health such as anxiety, functioning, and quality of life. The next being its rapid onset. Brexanolone has shown to have a rapid onset of action in reducing depressive symptoms in women with postpartum depression. Brexanolone can produce significant improvement within hours after starting the infusion. This is much faster than other antidepressants, which can take weeks or months to show their full effect. Now that is a huge benefit, a huge pro right there to Brexanolone. I know this is frustrating, and with psychiatric medicine just in general, the treatments take a long time to take effect. And that's if they even work. You don't even know if they're gonna work. So again, if you can see effects within hours after treatment, which you can with Brexanolone, you can with ketamine, and you can with some other treatments, but most antidepressants take weeks and months. And this is often true with antipsychotics as well. Now, another pro to Brexanolone is its durability. It has shown to have a durable effect on maintaining improvement in depressive symptoms in women with postpartum depression. Brexanolone can sustain the improvement for at least 30 days after the infusion. This is longer than other treatments such as electroconvulsive therapy or transcranial magnetic stimulation, which may require repeated sessions to maintain their effect. Again, I talk about both of those treatments in other videos on my channel. I'll try and get a link in here for you. Check those out too. Another thing with Brexanolone is that it's convenient. It's administered as a single continuous intravenous infusion over 60 hours. This means that the patient does not have to take pills every day or undergo invasive procedures. The patient can also avoid the hassle of dealing with insurance coverage, prescription refills, or medication adherence issues. So what are some negatives or cons of Brexanolone? Brexanolone has some disadvantages. First off, it's very expensive. This is a new medication. It hasn't been out for very long. And with all medications that are still under license, they are very expensive. The list price of Brexanolone is $34,000 per infusion. Now that's a lot. This does not include the cost of hospitalization, monitoring, and other services that go along with Brexanolone administration. It may not be covered by insurances and may need prior authorization before the insurance company will pay any amount towards this. Therefore, Brexanolone may not be affordable or accessible for many women who suffer from postpartum depression. Brexanolone requires hospitalization and continuous monitoring, and as I mentioned before, that's expensive, but it's also time consuming, and it also takes you away from your family, takes you away from your friends, and especially if you have a new baby, it may be taking you away from your new baby. So that's one downside to Brexanolone. But on the other side of this, severe postpartum depression will end you up in psychiatric care anyway. And so you may end up being monitored for weeks anyway. So this is a very good thing because you can kind of do it. You see the positive effects. You can be released from the hospital. You can feel good. You can go back and be with your family, and you can be with your new child. Brexanolone may have some serious side effects, which I mentioned before. Brexanolone may interact with other medications or hormonal contraceptives. Again, ask your doctor or pharmacist about this, and I'll have some more details in the full article linked in the description. Okay, in conclusion, Brexanolone is a novel and innovative medication that offers a new option for women who suffer from postpartum depression. Brexanolone has shown rapid and robust efficacy in reducing depressive symptoms in women with moderate to severe postpartum depression. Brexanolone has also shown a favorable safety profile in clinical trials, with most adverse reactions being mild to moderate and transient, meaning they will go away. However, Brexanolone also has some disadvantages and limitations that may limit its use. Brexanolone is very expensive, requires hospitalization and continuous monitoring, may also have serious side effects that require intervention or discontinuation of the infusion, and may interact with medications or hormonal contraceptives. Therefore, Brexanolone should be used with caution and under the guidance of a qualified healthcare provider. Brexanolone is not a cure for postpartum depression, but rather a symptomatic treatment that can provide a temporary relief for some women. Brexanolone does not address the underlying causes or factors that contribute to postpartum depression, such as stress, trauma, social support, lifestyle, or coping skills. Therefore, Brexanolone should be used as part of a comprehensive treatment plan that includes psychotherapy, social support, self-care, and other interventions that can help women cope with postpartum depression and prevent its reoccurrence. Thank you so much for watching this episode with the Anxious Resistance. I know this was long and packed with information, and I really hope you enjoyed it and learned something. This is a novel treatment, totally new. I love that it hits on some of those hormonal causes of depression. This hopefully can be a game changer for women, but it needs to become less expensive, it needs to be easier to administer, and it needs to be available in more places. Thank you so much for watching this. I hope you learned something. If you enjoyed it, like the video, subscribe for more content just like this, and I'll see you next time.